We can treat all the way from patients with malignancy, from primary brain tumors, to patients with cancer that spread to their brain. Those usually are the more common ones. We also treat some benign tumors like meningioma, acoustic neuroma. They are benign, slow-growing type. We also treat some functional disorder like trigeminal neuralgia, tremors.
In order to best localize and treat the tumor, as I call it, a hotspot, and spare the rest of their brain weak sources of radiation and focus the intense radiation in one spot, we put a lightweight titanium frame around their head that we fix to their skull. The frame placement starts at 7:45. It's on by 8. If all scheduling works out, they're in the MRI scan right away. Let's say the MRI scan takes about 25 minutes. That's done. The patient is brought down here. During that process, we begin planning on the planning software. If it's a simple plan, that can take as easy as 15 minutes. If it's a complex plan, they can take upwards around an hour.
And then after that's done, patient's brought into the room. Treatment can range from 40 minutes to 2 hours, depending how many lesions we're treating. For the patient, probably takes at least half a day, but then they get to go home, frames removed, no restrictions, they can do anything they want. It's a way for us to treat someone without cutting their brain open. Neurosurgeons love that, like Dr. Goldman basically allows us to do a non-invasive approach. It's quick, patients recover very quickly, hardly any side effects most of the time.
Trigeminal neuralgia and metastatic disease are certainly the most common things we treat here, and depending on the type of tumor, where it's spread from, or the histology of the tumor, there's an 80% chance of what we call local control, and that means the tumor will be taken care of or controlled by the radiation. The recurrence rate of a metastatic tumor that is just surgically removed is on the lines of 45 to 50%, with the resection area or tumor bed being treated with gamma knife afterwards decreases that to less than 20%.
It's just another way of doing radiation, but a more focused, more accurate and precise way of doing it.
It's pretty amazing. It's pretty amazing how effective it could be and saves patients otherwise very invasive and perhaps high complication surgeries.